Now, with all the fallout from Mylan Pharmaceuticals essentially jacking up the price of EpiPens over 450%, well, I would actually like to take this opportunity to highlight that Mylan being able to do this, it's not a bug in the system, right? No. It's a feature. Now, what do I mean by that? Well, it means that our system is set up in a way that allows and encourages this to happen. How? By essentially allowing monopolies through patent laws meant to protect drug companies. Now, The Verge explains. Researchers from Harvard Medical School looked through medical and health policy papers published in the last 10 years in an effort to find out why people in the United States spend almost twice as much on prescription drugs in 2013 compared to the 19 other industrialized nations, and why those prices are continuing to go up. Look, it's no secret. We pay far more than everyone else does in the industrialized world. We're the only one that pays so much for not only healthcare but for prescription drugs. Why the hell is that? Well, this paper goes on to explain. But first, I also want to mention that this isn't a new thing, right? When Martin Shkreli increased the price of Daraprim several thousand%, everybody was outraged, right? Like, this is a new thing. It turns out, no. This is something that's been going on in America for a very, very long time, and now we're just starting to catch on to this. Like, oh my God, I can't believe it. Corporations left to their own devices will raise the price of medication that is needed by hundreds, sometimes thousands of percent for no reason other than to put that money in their pocket. Well, no surprise. That's what corporations do. They are profit-making machines. That's their whole point. So should we be all that surprised that this has happened? No, but I'm going to go through as to why it happens anyway. Now, this is according to Aaron Kesselheim, who's a professor at Harvard Medical School and the director of Harvard's program on regulation, therapeutics, and law. According to him, last year's PharmaBro case was one of the major stories in the last year's news cycle that brought attention to this issue. But it's been a case that high drug prices and their effects on patient care have been an issue for a long time. That's what he says. He says they're an issue because when people can't afford a medication, they stop taking it. Some will stop taking it, some will cut it in half to make it last longer, some will use medication that has passed its expiration date. Now, that is not a good thing. Now, I'm not saying that if you take something that's expired that you'll die from it. No. In most cases, you won't. And it's, of course, depending on the medication. But usually, the older it is, the less effective it is. Now, in the case of the EpiPen, after a year, yes, that loses potency. Now, in an emergency, it might not be enough and could end up being deadly. That is one where it could definitely be a bad situation using an outdated med, so don't do that. Well, if you take outdated aspirin, that might not affect you so much. Now, as I said, those lose potency, and so, they're not as effective. That could lead people to take more to get the same effect. That also could lead to certain problems. So, using outdated medication, not always the best thing, but it's not like deadly in most cases. So, look, not having affordable prescription medication, that's a big problem. We can all agree on that at least. So what are the solutions? Well, Kesselheim and his colleagues propose a number of solutions. Those include giving Medicare the power to negotiate prices, something I'm in favor of, as well as removing some of the regulations that keep generics from entering the market. Now, the authors also suggest educating payers, providers, and patients about how effective competing treatments are, and having pharmacies automatically substitute cheaper generic drugs for pricey brand name prescriptions. Now, those would be a start, right? Those would be a start. Now, I want to get into Medicare for a second here. Now, conservatives point out that Medicare is incredibly expensive. They use the argument that since Medicare is so expensive, and look, we got to end it. We got to stop this program. Well, Medicare is an incredibly popular program that a lot of people really love and a lot of people rely on for their health care. So no, don't take that away. It's a super popular program, and besides, it's not Medicare's fault that it costs so much. And I'm going to explain why. First, they say, we can't afford it, we can't afford it. We also can't afford single payer. That's the argument they use against that. So why is it so expensive? Well, it's because of the partly the high cost of prescription drugs. You see, if Medicare is unable to negotiate drug prices, then these companies, as we've seen with Mylan Pharmaceuticals, Turling Pharmaceuticals, they will charge whatever they want. Medicare loses, becomes more expensive, and then certain politicians will look at that to say, hey, let's get rid of Medicare, let's get rid of these. Then everybody loses, right? In other countries, however, that have nationalized healthcare systems, single-payer systems, like the UK, like Canada, right? Government organizations can negotiate prices and coverage of drugs based on how effective they are compared to other similar treatments. So they can negotiate. We're blocked from doing that here. In fact, in 2003, the Medicare Modernization Act prohibited the Department of Health and Human Services from getting involved in price bargaining. Now, individual prescription plans within Medicare can negotiate, and when that happens, hey, look at that. You might get a lower price for this medication. If we actually expanded that power to the entirety of Medicaid or Medicare, well, that would save a lot of money. Now, the other problem is it's not just about prescription drugs and not being able to negotiate with drug manufacturers. No, the other problem is patents. If a patent runs too long, well, it guarantees price hikes by essentially eliminating competition for a set number of years. In a paper published by the Journal of the American Medical Association, they explain how our patent laws basically exist to create a monopoly on drugs. Now they write, the first is exclusivity granted by the FDA that gives new small molecule drugs like aspirin and biologics, such as antibody or protein drugs, windows of 5 to 7 years and 12 years, respectively, before generic versions can be sold. And patents can protect the active ingredient and chemical structure of a drug, as well as less fundamental aspects like its formulation and coding, for 20 years or more. Generic manufacturers can sue to challenge these patents, but in a practice called pay for delay, big-name pharma companies settle the suits and pay generic manufacturers to wait it out until the patent expires. Pharmaceutical companies win, and we lose. We still end up having to pay for those full-price brand name prescriptions because the generics are sitting around waiting, taking their pay cut. 20 years on one of those. 7 to 5 to 12 to 20 years or more, man. Look, I got a brother-in-law with Crohn's disease, right? Now, his medication, he has to take Humira for it, right? Humira is pretty expensive. It's one of those biologic drugs that has no generic version. That means he's got no choice but to buy the more expensive. The only option that he has is the expensive Humira. There are no other options. Now you might bring up, hey, look, I understand that, but look, these companies need patent protections because making drugs is expensive, doing the research and development and all the marketing and all that other stuff. Well, and they're just doing this, they need these patent protections so they can make a profit, right? So they can recoup their losses, make a profit from that research and development. Look, I understand that, and to an extent, I'm okay with them getting something back, right? But here's the thing. Some of these drugs, for example, Mylan's EpiPen, they were developed not by Mylan, but by another company, and guess what? With taxpayer funding. You paid for that. In fact, Harvard's Kesselheim notes that there's evidence that a lot of the innovation that goes into new drug development actually happens not in private corporations. No, it happens in academia and government-owned laboratories. And then, of course, the government creates this. A private corporation swoops in, buys up the patent, and then says, What now? I get to sit on this for the next 20 years and jack up the price to whatever I want. They did it with Daraprim. They did it with EpiPens. They're doing it with insulin. This is not an isolated thing. This is how this system seems to work. Now, let me ask you, if we pay for drugs to be developed, how come we allow private corporations to take the sole ownership for the patents for the 7 to 20 plus years? That's insanity. That's bullshit. Why do we allow that? No. We got to change that system. See, these things together have made it so that Americans end up paying more than the rest of the entire world for the same kinds of medication, which, by the way, are available elsewhere for much cheaper than what we pay for it. To those who don't want to change this system, knowing how fucked up it is, I gotta ask, why? Do you like that we all have to pay more for the same drug than people in Canada or the UK or Denmark? Do you like throwing away money? Or do you like the idea that healthcare is a privilege only reserved for a few people? Is that what you think? I hope not. No. We've got to change this system, man. We've got to change this system. We've got to do something about the patent laws. We've got to stop these drug monopolies, and we've got to get Medicare and other government programs to be able to have the power to negotiate with these drug companies. And you know what? My solution is going to a single payer system. Now, we don't have to go to a single payer system in order to do these other things. So there's no excuse to not do patent reform, to not do Medicare being able to negotiate prices. We can do something about this, but only if we all rise up and demand it. Hey everybody, if you liked this video, then please like this video and share. And if you want to see more like this, then please hit that subscribe button below.